So the Gauteng Department of Health recently hosted the third Provincial Research and Innovation Summit, which focused on reconfiguring health systems for a better future. So the summit tackled important issues in health research and policy, aligning with the national objectives like universal health coverage and sustainable development goals. Let's talk a bit about this now with Tsholofelo Adelekan, who is the Chief Director of Policy Planning and Evaluation at the Gauteng Health Department. Thank you so much, ma'am, for joining us. We do appreciate your time. Let's start with what the main objectives of this health summit were.
Excellent. Good morning to the viewers and to you, Ms. Griselda. We wanted to make sure that there's a platform where researchers and policymakers can exchange ideas on how to help address the pressing challenges of the healthcare system. And secondly, we wanted also to stimulate exchange of ideas across various participants, also on helping us to move towards, optimizing the health system inefficiencies that we're currently experiencing, and also sharing with us some of the evidence on how other sectors and maybe other countries have helped improve the effectiveness of the healthcare system. And lastly, we also wanted to ensure that we improve the effectiveness and capacity building of our health workers, and as well as other, our parties, to be able to conduct research, rigorous research, research also that would be able to close the gaps between, the type of research outputs that are being produced, as well as the type of information needs or evidence needs that we have in the department. So those were the three major objectives of, this particular research summit.
Yeah, and how does the summit aim to address, some of the current healthcare challenges in Gauteng, which have been widely reported?
The summit helps us in many ways, Griselda. One of the major ways is we are able to, establish research priorities for the 7th administration, which would then serve as a guide for academia, for research agencies, for various, sectors, to be able to understand the direction and the pressing health needs that we want evidence on. And secondly, with these research priorities, we are able to also influence the direction of resource allocation and resource distribution to focus on areas where, impactful research could be conducted. And lastly, we're hoping that with the evidence then that can be generated from all these types of research outputs, we should then be able to help the department strengthen our operations in terms of, efficient practices, as well as making sure that we meet the needs of the people that we serve.
And what role, does or do digital innovations, such as telemedicine, play in the future of healthcare delivery? Let's talk about Gauteng.
Great. So telemedicine and any other, ICT technology does play a significant role in healthcare delivery. Maybe for the purpose of the viewers, telemedicine, it's remote, clinical provision of a service. So basically, you remotely connect with a clinician or a health worker to be able to, access, treatment or, diagnosis of a particular condition. So in light of the current challenges that we're facing, we have to obviously innovate on how we can improve access to our service users. We've got service users that perhaps have mobility challenges that could consult with our health workers telephonically and be able to, receive the necessary treatment. We've got a high, a number of geriatric or elderly population within the province that might find it difficult to come to our facilities. So we are able to use and leverage that kind of technology, and people don't have to then, come all the time to our health facilities. And ultimately, with this kind of technology, we're also able to improve our efficiencies. We're able to make sure that there's data that is generated from clinical settings that can then help improve the, health outcomes of our patients.
Let's talk about some of the outcomes or findings from the summit, some of the key ones.
No, certainly, Crystal. I think the key one in this Innovation Summit is the establishment of a framework of research priorities that will then guide universities, academia, and research agencies in terms of what type of research are we going to focus on this 7th administration. And again, we're able to have, a call to action for all the researchers, all universities and stakeholders to be able to ensure that whatever research that is going to, be implemented going forward, it must be research that will also close the gap between policy, and practice. Ultimately, we've also been able to, ensure that there's, collaboration. We fostered collaboration between the various stakeholders that were present at that particular summit.
Tsholofelo Adelekan, thank you very much indeed for that. We do appreciate your time here on the show. Tsholofelo Adelekan is the Chief Director of Policy, Planning and Evaluation at the Gauteng Department of Health.